እንደምን አመሻችሁ good evening all እንኳን ለዚህ ቀን በሰላም ደረስን እንኳን አደረሳችሁ እንላለን በዛሬው ቀን የተገናኘ ነው እንግዲህ በዚህ ሰሞን አጠያቂ የሆነው የኮቪድ-19 ክትባት ወጥቷል ኮቪድ-19 vaccination እና ስለሱ መልስ በECLA በኩል ብዙ ጥያቄዎች ይመጣሉ የክትባቱን ውጤቱ ምንድነው ማንነውስ የሚከተበው ወይም ደግሞ who's getting vaccinated and who are the part of the population who are at risk there are all doubts and questions about the vaccination itself one thing is it happened so quickly within few months they were able to produce the vaccination so we want to address these issues and then more and we do have people from in this field in the medical field in Los Angeles area and our discussion today will be part in Amharic part in English so all of you will get the information and soon we'll have maybe a full Amharic and a full English program on this this is something that we will continue to do as we learn more information about the vaccination and the virus itself. Today we have, as you all know, our volunteer, our sister in the medical group, Marta Taddese, who is RN and then MPH. And then we do have Tigist Teshale, who also serves in ECLA, our sister who's always here for us when we have questions and she is also a family nurse practitioner and an RN and then we do have a special guest today from Los Angeles from this area Dr. Rai who's with us who will go into depth about the vaccination and where we're at this point their own experiences too so they will share their own experience and then one good thing we have is Tigist is one of the people who was on the front line by the forum actually executing this vaccination. So hopefully you will learn a lot from this and then we'll keep posting all the information on our Facebook, on our other social media and also on our YouTube channel. So thank you all for being here. We really appreciate it for you guys to join us. I'll start with this, Dr. Rai, I'll start with you. How does the vaccine work? It's been around now and how does the vaccine work itself for us to be cured from it?
Hi, nice to meet everyone. Thank you for having me here and letting me talk to you all and help out with this program. So the how the vaccine actually works is really amazing. The technology behind it is yes, it's newer, but they've been working on it actually for quite some time now. So basically, traditionally, what older vaccines, the vaccines that we normally get, like the pneumococcal or the pneumonia vaccine or an influenza vaccine or other childhood vaccines that we usually get, essentially what they do is they take like what they call an inactivated part of viruses or like part of a protein or part of the virus that's not active. And they usually use that and they introduce a little bit of that into your body. And so your immune system recognizes that as foreign. So it builds your immunity to that. It recognizes that bit and it builds an immunity to that part. What's really interesting and really amazing about this new type of technology, the mRNA vaccine, is what it does is that it's almost like mRNA is like a blueprint basically. And so it's a blueprint for like a structure or a part of the virus. And for within this specific context for the COVID vaccine, it's called the spike protein, which is basically like the key that the virus uses to get into your cells and infect you. So the mRNA is a blueprint for that spike protein. And so what the vaccine does is this blueprint is, so it's not actually the part of the vaccine or the part of the virus, it's the blueprint that is introduced into your body. And then that is actually taken up by your own cells. And then your cells produce that spike protein, right? The blueprint is coded into this spike protein, so that your own body creates this protein, and then essentially your immune system recognizes that as foreign. So it builds up this immunity against it, so that if you ever are exposed to the coronavirus and you're ever exposed to the spike protein, then your body already knows that that is foreign, and then already has a defense system that has been established to attack that spike protein. Does that make sense?
Yes, yes. I mean, it's interesting because people are really concerned. Yes, you just mentioned to us that they've been working on it for a while, but at the same time, as far as the public knows, this thing was produced so quickly. So people are really not as comfortable as far as its safety. So why do you tell us? And now you just told us about how the vaccine works,
Mm-hmm.
but also how does this make it safe? Does it matter how long it takes to make the vaccine to make it safe, or is just the public being just scared about it?
Yeah, no, I mean, I think it's very reasonable to have questions and have doubts. A lot of medicine, a lot of times the medical community doesn't do a good job of explaining, sort of the processes that happen behind the scenes, how these things are created. And that can be an issue that can cause issues with trust with the medical community. But this technology has actually they've been studying it, and they've been working on it for almost decades now. It actually started like in the 90s. And then it was really more solidified in the mid 2000s or so. And they actually have done trials on humans of these mRNA types of vaccines with if anyone is aware of rabies virus, when the Zika virus pandemic occurred, however many, I think almost 7 or so years ago. They used it for the influenza. There were trials for the influenza. So these are actual trials that they used with this technology on humans, however many years ago. So they've been working on this for a long time. It's just that obviously more recently during this pandemic, because of how devastating the effects have been and how widespread they've been, not just here in our country and elsewhere in the world, they just kind of really accelerated the process. But the actual technology itself and the knowledge about this type of vaccine has existed for 20 plus years now.
Okay. Before we get into the efficacy of the two vaccines and the other details, I would like to ask you: have you taken the vaccine, and when did you take it? Have you taken both doses? Did you have any hesitation when you took it? Yes, you are in the field and you're working, but then was there any did you have a member saying, especially in our community, hold on, or something like that, or did you take both of them by now?
Yeah, so I work at LACUSC Medical Center, which is in East LA. I'm a resident there, and so the vaccine that was initially made widely available for us was the Pfizer vaccine. And fortunately, we were lucky enough as frontline workers to get it be one of the first people to get access to it. So I got my first dose. I've gotten both doses already. My first dose was sometime mid or end of December. And then my second dose was 3 weeks later. So it's been about 2 to 3 weeks since I got my second dose. And I was very excited to get it. Unfortunately, because of the work, I work in the emergency department. I work on the floors. I work in the ICU, and we kind of rotate everywhere. So, unfortunately, as physicians working in the hospital, you see kind of the worst of the pandemic. And so for me, I really wanted to get vaccinated as quickly as possible. And most of my coworkers were very excited to get the vaccine. My first dose, I didn't feel anything except for a sore arm. So that was fine. My second dose, I did feel a little bit more tired after, kind of a little achy. But, you know, I didn't really, and I like had a little bit of a headache too, but that didn't last for very long. And I never had to like miss out of work. I pretty much had very, very minimal symptoms. So all in all, it went pretty smooth for me. So.
Okay. How about you, Marta?
I'm a little bit different from Rai. I was very hesitant. Even though I am a first responder, I do work, I do see patients, I do COVID testing. I just was very hesitant. And the reason really is I have a lot of allergies. So I was really trying to accept it in my head that I would be okay. And then finally, when is it? A week, 2 weeks ago, I finally got up the strength and I literally dared myself to go get it. And as Rai said, it was pain at the injection site. And other than that, I mean, I felt little twinges here and there, but I really couldn't put my finger on what it was. But I worked throughout the entire time. But one thing that really also persuaded me to take it is if we don't get vaccinated, we can't get the herd immunity to protect each other. Okay, if all the healthcare workers get vaccinated and then, you know, the first tier, second tier, as we get vaccinated, then we literally protect each other. That's what herd immunity is. So that is what really, I would love to protect my kids, my grandkids, by being vaccinated. And that was the turning point for me.
Okay. So you did the first one. So when is your next one now?
I have February 10th, the second week of February.
Okay. Okay. So, you know, and sometimes I heard somewhere, like, for example, do they, when you take the first vaccine, do they make the appointment for the second one right there? Or do you have to call back and make an appointment for the second one?
No, when you go for your, okay, I got my through work. So I actually went to Rai's hospital to get my vaccination. That came through HR, through work. They sent an appointment saying, once I signed and said, yes, I'll take the vaccination, they sent me an email saying, you're scheduled for this date. The day I went for the vaccination, they checked my paperwork, then they gave me a card. On the card, it said what vaccine I took, what day, what date. And then on the back of it, it said what date I had to come back for the second dose.
Okay. Okay. Yeah. Tigustia, what was your experience?
Okay. Salam. የኔ ኤክስፒሪየንስ ደግሞ አይ ቲንክ የሁለታችሁንም ነው። መጀመሪያ ኮቪድ ሀፕን እንዳደረገ ቫክሲኑ ሲመጣ ላይቭ ቫክሲን ከሆነ ማለትም ቅድም ዶክተር ራይ እንደነገረችን ይሄኛው ኢንአክቲቭ ነው። ላይቭ ከሆነ ግን አልወስድም እል ነበረ። ከዛ ኢንአክቲቭ መሆኑን ሳቅ I was excited to take it። ግን ብዙ ሰዎች አብረውኝ የሚሰሩ ወይንም ደግሞ ማቃቸው ሞር ዌል ኤጁኬትድ ናቸው ምላቸው ሰዎችም እንዳትወስድ ቫክሲኑ ያመክናል ወይንም ደግሞ ጥቁሮችን መሞከር ያላደርግ ነው ምናምን የሚባል ብዙ ኮንስፒረሲ ቲዮሪ ሰማሁና I was like ብዬ ማሰብ ጀመር። ከዛ ግን ሞር ሳነብ about the vaccine I was excited። ግን አሁንም የቫክሲኑ ኮስቸነር አንዱ are you planning to be are you pregnant ይላል ወይንም ደግሞ are you planning to be pregnant in the next 90 days የሚል question አለ እና እሱን ሳነብ before I took the vaccine I was preparing myself እና when I find out that I called my OBGYN and I had that discussion because I'm on my productive age so I want to make sure it's not going to affect me ከዛ ኦቢጃይን ጋር ዲስከስ አደርግ ምንድን ነው ያለችኝ go ahead take it because መጀመሪያ ላይ ፕሬግናንት በሆኑ ወይንም ደግሞ በሚቀጥለው ወራት ውስጥ ፕሬግናንት ለመሆን ለሚፈልጉ ሰዎች ኢናፍ ሪሰርች የለም የሚል ነበር። አሁን ግን ፕሬግናንቶቹም ወስደውታል ወይንም ሊሆኑ ያሉትም ወስደውት ምንም የመጣ ሳይድ ኢፌክት ወይንም ደግሞ ኤኒ ኢፌክት ስለሌለ go ahead ወሰጁ ብላለችኝ። እንደውም ላከችልኝ ዶክመንቱንም ሰፖርቲቭ ዶክመንቱን አነበብኩኝ። I get comfortable ተራዬ ሲደርሰኝ ኤክሳይትድ ሆኜ እኔ ወሰድኩት። ሶስት ግን ከዚህ በፊት ፍሉ ቫክሲን 3 እንደሚያደርገኝ ነው የሆነው ለኔ። normally when I take flu vaccine I have the same symptom which is a little chill, kind of body ache እና sore arm. እሱ ኔክስት ዴይ ነው ሀፕን ያደረገው። ከዛ በሚቀጥለው ቀን እየጠፋ ነው ሄደ። ሁለተኛው ቫክሲን 3 ትንሽ ኢንቴንሲቲው ጨመር ይላል፣ ግን ከዛ ውጭ ግን ምንም የተለየ ነገር ሀፕን አላደረገም። I'm here.
Okay. Yeah. And just to ask, maybe Tigist or Marta or Dr. Rai, even after taking the vaccine, you still have to be conscious about wearing a mask, and then the 6 feet still applies, Adela?
Yes.
Yes. Yeah. Okay.
Yeah, definitely. Especially because, they still haven't studied exactly whether you can still, they still haven't studied the effects of whether you can still potentially transmit the virus. Even if you yourself don't get sick, they haven't studied whether you can still pass it on to other people. So we still have to wait till that data comes out. So you should still, be wearing your mask. You should still be socially distancing. You should still be practicing like good hand hygiene and everything like that.
Okay. And let's come back to the vaccine now, Dr. Rai. What is the efficacy of the 2 vaccines?
Yeah, so right now, the 2 that have been released, so the Pfizer vaccine and the Moderna vaccine, they're both mRNA-based vaccines, like I was talking about before. I know that there are some other ones that are in the pipeline that will probably be released in the near future, but right now it's just the Pfizer and the Moderna. And basically, like the efficacy or how effective they are at preventing like illness with COVID with symptoms. For the Pfizer vaccine, after the 2 doses, and then you have to wait, a couple weeks after that to get the maximum amount of immunity, is 95%. And then for the Moderna vaccine, it's almost the same, like 94.1%. But essentially, they're for all intents and purposes equal at being effective in preventing you from getting like symptomatic COVID disease.
Okay. So we will stay within the vaccine, and if you can cover this area for us, like 2 areas. One, is there a risk of mortality with vaccine immune response for elderly people? And then also, what is the rates of the most severe allergic reactions?
Right. So those 2 questions are kind of go hand in hand. So there have been, very, very rare, a small number of cases of these severe allergic reactions, or what they also call like anaphylaxis. And any person that has that type of reaction, that after administration of any one of the vaccines, those are reported to the CDC. And so based on the statistics that they've gotten in the CDC so far, these are, I think they release it every month. So we have up to December's numbers and statistics. And based on that, there have been 21 of these severe allergic reactions after vaccine administration, the majority of which happen within like 10 to 15 minutes of the vaccine administration. And that's out of nearly, I think it's 1.9 million doses that were administered. So only 21 out of 1.9 million doses that were given, based on the CDC's numbers, had this severe reaction. No one died as well. So no one has died from any of these reactions because people have sought appropriate medical attention. And these are totally treatable symptoms that you have. We have medications and treatments as long as you go to the, go see your doctor, go to the emergency room, or, if they're at the sites, they're taken to the hospital. Those are easily treatable symptoms. So yeah, 0 people have died, only 21 reactions out of almost 2 million doses that have been given. So the chances of that happening to anyone are extremely, extremely low.
Okay. When it comes to allergy reaction, Marta, you just mentioned to us that there was a concern that, because of your allergy reaction, some allergies that you have, that you were concerned. So now hearing this, does it really give you more confidence in going back and doing the second one, and also encourage others to do the same, Marta?
Oh, definitely. As I said, I literally have bad allergies to pollen in California. So my allergist said I should not be living in California. Okay, putting that aside, I've never gotten a reaction from the flu vaccine other than the soreness in my arm. So I knew in my head that it wasn't, I didn't have allergic reactions to a vaccine so far in my life. But the fact that I have the post-nasal drip, the congestion, the coughing, the sneezing, I just did not want to add, by getting a vaccine, to add to those symptoms. Having taken the vaccine, I'm glad I did it, because if it will protect me to not get the COVID disease, and if it will protect my coworkers and anybody I come in contact with, for me not to pass the disease, hopefully after I get the 2 doses, then it's a win-win.
Okay. And ሌላው ትልቅ እድለኛ የሆነው ትግስት ስንት ጊዜ እንደሆነ አላቅም ጀምረሻል ኦልሬዲ ፍሮንት ላይን መስራት ፎረም እየተገኘሽ ያው ክትባቱን መከተብ ላይ ነሽና በአጠቃላይ ያለሽን ኤክስፒሪየንስ ስለሱና አንዳንድ ሰዎች ለምሳሌ እዛ በመኪና እየመጡ የሚወጉ በቴሌቪዥን እንዳየነው ይወጉና once they get vaccinated, then they go home and then they might have any type of reaction. ከዛ በኋላ ለማን ነው አቤት የሚባለው እንደሚባለው ያ እንዴት ነው ሃንድል የሚደረገው? ያንቺስ ኤክስፒሪየንስ እንዴት ነው? ለስንት ጊዜስ ነው ፎረም አሁን እየሰራሽ ያለሽው? በአጠቃላይ እሱን ብትነግሪን ትግስት።
ኦኬ እሺ፣ አሁን እየሰራው ያው የምሰራው ለሎስ አንጀለስ ፐብሊክ ሄልዝ ነውና we're vaccinating like mega የሆኑ ቦታዎች the forum, Cal State Northridge, Fairplex, and Dodger Stadium, and Magic Mountain ላይ የተለያዩ ሴንተሮች አሉን ማለት ነው እና እኔ ስፔሲፊክሊ የምሰራው ፎረም ላይ ነው እና በቀን more than 2000 ነው vaccinated የምናደርገው። ምንድነው ሰው ኦንላይን ገብቶ አሁን currently we're doing healthcare workers direct patient contact ያላቸውና 65 and above የሆኑ ሰዎች ኦንላይን አፖይንትመንት ካስያዙ በኋላ drive through ይመጣሉ። when they come, we are very organized and we have a lot of resources. We have a lot of volunteer doctors and nurses and physician assistants and even non-licensed people. We have a lot. So we're very organized. When people come drive through, we have people by the door screening them. The first thing, are they registered or not? Do they have appointment or not?
That's fine.
After they screen them, other medical professionals, doctors or nurse practitioners or physician assistant will screen them again. That one is, do they have any allergy reaction, or do they have any history, and do they have any autoimmune disease? All this question. According to that, we will send them in different lane. Do they have to be monitored for 30 minutes, or do we have to monitor them for 15 minutes? Because if they have a history of anaphylaxis or severe allergic reaction before for any kind of vaccine, or if they have allergic reaction, even normal allergic reaction, we have to monitor those people closely. So we have like certain providers who is doing that screening, and then after we screen them, we send them with the right lane, and then they will go through that lane and they will get their vaccine. And then after they get their vaccine, there's other providers, other medical providers, the same doctors, nurse practitioners, and physician assistants will monitor them for 30 and 15 minutes according to their history or situation. And then after we monitor them, of course, we will tell them if anything happened, if you experience this and that, go ahead, call your doctor or call 911 and go to emergency room, which is if they have difficulty of breathing, if they have chest pain, if they have any anaphylaxis signs, which is swollen tongue, anything, body rash or difficulty breathing or having chest pain or dizziness, severe headache, those kind of things. So that's what we're doing so far. I've been there. We started in January 19, Tuesday. So this Tuesday is going to be 2 weeks and we're doing it 7 days a week. And so far we didn't have any anaphylaxis reaction yet. And people are really responding to the vaccine really, really good. Even we have people who really want to get vaccinated, even though they don't meet the criteria, we have to return them. So what I tell our community, our people is when it's time for you, don't hesitate. This is an opportunity we can really fight this pandemic together. And so far, and instead of like hearing news are good, but more than news, go to CDC or public health website and read about it, read science, not only news, not biased information. So that's all I will say.
Okay. Maybe I can come to you, Dr. Rai, on this. Is there, to this day now, as of today, is there any part of the population that shouldn't be vaccinated, that is left out from this group of people who are vaccinated?
Well, as of right now, unfortunately, the Pfizer vaccine and the Moderna vaccine were not tested in like younger children. So the Pfizer vaccine is what they call validated or was studied only in ages 16 and up. And then the Moderna vaccine, I believe, was 18 and up and older. So but that's just as of right now. And I know that they're doing, studies currently on younger populations so that they can roll out the vaccine for children in the near future. So Pfizer 16 and older, Moderna 18 and older. And then of course, if anyone has a severe anaphylactic or severe allergic reaction to their first dose, then they should not be getting the second dose, unfortunately. But aside from that, the vaccine is open to everyone.
Okay. And for all of you, maybe you can answer this, and this is just out of the blue question. Do you predict that this vaccine now, because we hear that there are different variants now that are coming out. We hear in South Africa, in the UK, and then in some countries in Africa that I think the virus itself is like, okay, it's growing, so, and it is having different variants. So do you think this is something that will keep going on for the next, this virus will be part of our life for a long time? Or do you think there will be some type of elimination that we will not hear about it within a year or two? Just a thought, if you have a thought on that.
I can try and maybe. So yeah, that has definitely been a concern in the medical community, and I know I've been talking to a lot of my co-residents and people that I work with about these like new variants. And, luckily the vaccine is, again, for the blueprint, the mRNA, it codes for the spike protein, which is the main protein that allows the virus to enter your cells, right? So it's like I said before, it's like the key. So your immune system basically develops its defenses against this key that allows the virus to enter your cells, which is brilliant. So it helps both in targeting and then also keeping it from entering your cells. The problem with these new variants, so far they haven't seen any changes in what, that spike protein is still common in all of these viruses in the variants, which is, a good thing. So that's why it's really, really important for everyone to get vaccinated and immune to this virus as quickly as possible, because one of the reasons that's causing these mutations is the fact that it is just kind of the infectivity, like it's passing from one person to the next. And as the virus replicates more and more, there are more chances for it to mutate. So we really need to get everyone immunized so that we can reduce the risk of it mutating to the point where, potentially the vaccine could be ineffective, right? Theoretically. Hopefully that does not happen. But that is always a risk. But again, when Martha was explaining the concept of herd immunity, that's why it's really important for us to get that herd immunity, which is to get, a certain percent of the population, whether it be 60, 70, 80% immune to this virus and the strains that exist now, is really important because, at that point, it won't be as, if we have this like baseline immunity, it won't have the same like devastating effects that it has now, where it's just, killing literally hundreds of thousands of people.
Okay. All right. Well, we don't want to keep you for long. I know you're hardworking people in our community. I know you're on the front line doing your best, Tigist, especially being out there and doing this. We really thank you. Thank you, Dr. Rai, for giving your time and coming in and discuss this with ECLA. And we hope that you'll come back and pay us a visit, and then also be part of our, for ECLA, so that we can have a lot of information like this go out to our community. Marta, as usual, we thank you very much for organizing this, for bringing in Tigist and Dr. Rai together this evening. So unless you want to add anything, if you have a message that you want to send to our community, we'll end it here, and then definitely we'll come back and ask you for more updates, and then we'll invite you back. If not, I will just say good night, and we'll see you. በዚህ ሁላችሁም ይሄንን የተመለከታችሁ ሁሉ ከዚህ ትምህርት እንዳገኛችሁ ነው የምናስበው እና ይሄንን እንቀጥላለን ኢንፎርሜሽን ማምጣት እንቀጥላለን ዛሬ በተለየ ቀን እንደውም ይሄንን ለእናንተ ልናስተላልፍ የፈለግነው ሳይዘገይ በፊት before it's too late we wanted to get it to you so hopefully you'll learn a lot from this and then we'll have more information from our own people who will come and discuss on COVID, the vaccination and the status of it. So I will say good night. ደናደሩ ሁላችሁም እላለሁ ማርታ ትግስት ዶክተር አይ በጣም ነው የምናመሰግነው ደናደሩ.
Thank you.